Hi there, my name is Andrew Slegemelch. I am a clinical psychologist licensed in Ohio and California, and one of my specialties is working with children with high-functioning autism or related neurocognitive disorders. I also call these, or they can be called, communication disorders. And that is the topic of the training for today. Is going to be a brief training on an issue that is often brought to me by parents. They describe situations where their children will kind of have these explosive negative responses to situations, maybe a disappointment or something like that. These do not necessarily respond well. These negative responses don't respond well to punishment, is what they tell me. They can be very inconvenient, like they happen in stores or restaurants or at school, and they can seem to come out of nowhere. And again, like I said, they tend to be pretty common in kids with communication disorders, and not just toddlers, but we're starting to see, or parents tell me they see toddler-like tantrums in kids who are, above that age, maybe 8 to 12, which is what we call middle childhood, and even up into teenage years. And I've heard parents report this in young adulthood. So what I think is going on here in these situations, and this is based on my experience, of course, this is a behavior that is consistent with something like a major clinical issue like depression. If you think your child is depressed, or if that is what's causing or maybe causing this, I encourage you right away, talk to your care provider, either the child's pediatrician or your general practitioner or a therapist, but seek direct clinical and professional help, healthcare help with this in real time. Okay, what I actually think is going on in many of these cases, though, is that, and because they have more of a historical nature to the events, like they seem to happen over and over and across the lifespan or across a couple of months or a couple of years, is I think that they're related to problems with self-expression. And indeed, when parents report when they talk with their children about this, the kids can't really describe their situation. They even come back after the fact and say, "What happened?" And the kid can really not quite describe what's going on. So I think what I've been recommending parents do, and we've been having some success with this, is in the moment, when you're having one of these large, explosive, negative behaviors, label the emotion. And I'm going to encourage you to do this as objectively as possible and say, "You look really upset," or "You look really mad," or "You look really frustrated right now." And parents in this situation want to go right to problem solving, and I'm going to ask you to stop the urge to problem solve. Now, if your child is throwing himself or herself on the ground in a restaurant and it's in an aisle or something like that, or you feel embarrassed, feel free to move your child gently, or otherwise kind of intervene in that way. But I would encourage you to avoid the wanting to work on it with the child. Okay. Instead, focus on labeling, and you can ask a question: why might you be upset, or what might you be upset about? Might you be upset about not getting the thing that you want? And don't wait around for an answer. Okay, what we're trying to do is connect the child's internal state to a context or to a word, and preferably both. Sort of like connecting it to a label that is commonly used, like mad or upset, and then to a context which kind of makes sense and puts the situation together for the child. So the key to this is not the magic pill approach to working with children. The key is going to be repetition and doing this in multiple situations. And parents have also reported when a child is excited and happy, success in kind of labeling those emotions. "You look ecstatic right now. Could this be, or what do you think this is connected to?" You can offer support, of course, saying, "If you want help, let me know," but avoid problem solving as much as possible. Obviously, with the more positive emotions, the urge to problem solve is not huge. But in the negative situations, avoid as much as possible the urge to start to solve the problem, and Instead, focus on labeling and offering support. So why do I think this works? I think linking a state a child is feeling with a word like that we all understand and use commonly, it's a process of objectifying the experience. And objectification is actually a strategy used in CBT, cognitive behavioral therapy, of describing your situation or your state and then receiving some relief from that or some understanding from that. So I think objectification can happen even if you're labeling the state for your child. Even if the child says, no, I'm not, that's still defining the situation. So you look upset and they say, no, I'm not. Knowing what it is not gets us closer to knowing what it is. So why else I think this works is because you're starting to teach your child how to communicate with a new language, and that language is the language of emotions and the words that we place on emotions and internal states. I have found this. I studied a language. I studied Japanese years ago, and I do remember very distinctly when I had my first communication, my first organic and my spontaneous communication in Japanese with the Japanese person. It was so extremely satisfying that it had, that feeling has stuck with me. And I think when you start to create these exchanges, these communications about internal states with kids, that can be very satisfying for them. And again, that's another reason why I think that this works, is that it's satisfying. So that satisfaction can sometimes overwhelm the negative emotion that they're feeling. Doing this process promotes a sense of community. You know, we talk about the downsides of isolation, and a lot of times kids that I work with are isolated or feel isolated or become isolated because they can't properly communicate their experience. So nobody knows how they feel. And they're actually right. We can guess, but we really don't know for sure. So when you're starting to put words on their internal states, it can kind of lift some of that sense of isolation. And again, through repetition, you experience that isolation left and you build a sense of community. Someone gets it. Someone understands me. And finally, the reason I think that this works is because it promotes self-advocacy. You can say to them, if you want help with this, please ask. Or would you like me to help you with this? And through acquiescence or just agreeing, yes, I want help, or nodding my head, they're self-advocating. And again, that provides a sense of control and agency through the act of self-advocacy. Now, eventually what you'll see is, if you're right, if this is what's getting in the way of them dealing with these intense negative emotions, and instead of expressing them through intense negative behaviors like tantrums, if this is what's actually happening, then you will start to see more spontaneous statements about how they feel and more spontaneous requests for help from you, or from reasonable people around them. So moving forward, what I'm recommending parents do is focus on the repetition. Do this as much as humanly possible. Label emotions and states. Talk about causes. Offer support, or at least in the cases of positive emotions like excitement and enjoyment, offer some sort of like, let's do this together. I'll be excited with you. Avoid giving advice, but you can offer it upon request. Ask me if you want help with this. I say this to kids all the time. And lots of kids find this very relaxing when I'm not spouting advice at them. And I would, of course, recommend that you follow up with your care provider on this issue if you're if you're concerned about your child's emotional state, about things like safety or isolation or those kinds of things. If they seem sad all the time, or down all the time, or negative all the time, or if they have these explosive behaviors or big eruptions or anything like that that concerns you, please talk with your doctor or with your clinician. Thank you again for watching. This is Andrew Slegemalch. I'm a clinical psychologist, and I'll see you next time.